Just 3 countries account for more than 50% of the global daily infection rate associated with COVID-19 as cases continue to surge in the United States, Brazil and India. Each of those 3 countries recorded at least 21,000 new cases in just the last 24 hours. The United States saw an increase in 50,000 new infections amid growing concerns that the world's richest country is failing to contain the coronavirus spread.
A picture or graph in this instance worth 1,000 words, a representation of daily infection rates in 20 countries that currently have the highest absolute daily number of deaths, including Russia, Iran and South Africa, with the US in orange and Brazil in green, sadly, in a league of their own.
We are still knee-deep in the first wave of this, and I would say this would not be considered a wave. It was a surge or a resurgence of infections superimposed upon a baseline that really never got down to where we wanted to go. If you look at the graphs from Europe, the European Union as an entity, it went up and then came down to baseline. Now they're having little blips, as you might expect, as they try to reopen. We went up, never came down to baseline, and now we're surging back up. So it's a serious situation that we have to address immediately.
With more than 720,000 cases, India, which recorded a daily record in new infections this past Sunday, delays now in the planned reopening of the Taj Mahal. In Brazil, the right-wing president and a brazen coronavirus skeptic has tested positive for the virus after showing symptoms in a country that has suffered one of the worst outbreaks anywhere.
No meu caso particular.
In my particular case, given my history of athleticism, if I was to be infected with the virus, I would not have to worry. I would not feel it. It would be like getting the flu or being under the weather.
But it seems like these in the United States that has infuriated health experts. Young people gathered in vacation spots and house parties near the former epicenter of New York City without a care in the world. No masks, no social distancing, and no real sense.
The last thing we need is to see this virus spike again. And there are 2 threats in that area. One, New Yorkers getting complacent. This is great, New York's doing great, the numbers are down. I heard the governor, he said everything is great. We get complacent. We get cocky, we get a little arrogant. That is a real threat.
With the southern Sunbelt states of Florida, Texas, Arizona and California having slowed or backtracked on reopenings with heightened concerns that ICU bed availability is fast reaching capacity in some regions.
When we think about the ICU bed shortage, I'm not just worried about the new COVID cases coming in. I think it is a really big concern about how we may have to ration care for other critical illnesses, especially when we know that heart disease is the leading cause of death.
President Donald Trump this past weekend saying COVID-19 was totally harmless to 99% of those who get infected. Pushback from Governor Cuomo.
Mr. President, don't be a co-conspirator of COVID. Do one simple thing. Acknowledge to the American people that COVID exists. It is a major problem. It's going to continue until we admit it and each of us stands up to do our part.
And as cases surge nationwide, demand for testing has soared, creating new supply chain problems for this administration. Sherwin Brycepease, SABC News, New York.
So Brazil's President Jair Bolsonaro has tested positive for the coronavirus. He took the test. He's 4th after developing symptoms, including a high temperature. So Bolsonaro has repeatedly played down the risks posed by the virus and urged regional governors to ease lockdowns. U.S. correspondent Sherwin Brycepease joins me now live from New York. Sherwin, very good evening to you. Thanks indeed for your time. So that's the breaking news that Brazil's President Jair Bolsonaro testing positive for COVID-19. What are you hearing?
Well, he's in that high-risk category, Griselda, 65 years old, 65 years and above. Of course, the very high-risk category. But Dr. Tedros is the Director General of the World Health Organization, striking a more conciliatory tone, saying, that he hoped for a speedy recovery, but that it shows that we are all vulnerable and that no one is immune. But if you take to social media, you will see that people are saying he's getting essentially his just desserts for downplaying this. This is a president that has clashed with his own health officials, that has moved very quickly to reopen the Brazilian economy. In fact, spoke against efforts from local and provincial authorities to slow down the spread by closing down, locking down, and social distancing. Bolsonaro spoke to reporters after announcing that he tested positive, Griselda, saying that he experienced fatigue, muscle pain, and fever. There are also pictures of him socializing this past weekend, the 4th of July, Independence Day, celebrated at the residence of the U.S. Ambassador Todd Chapman to Brasilia, sitting very closely together without masks, no social distancing. We understand the U.S. ambassador too now has to go for a test. Bolsonaro, despite all of this, saying he's feeling well. He credits being on hydroxychloroquine, the anti-malaria drug that has not been proven to be an effective treatment for COVID-19. The World Health Organization just this past week saying that it failed to reduce the mortality rate. So that's what you get for downplaying, I imagine, this deadly virus that really does not distinguish between who you are or what title you might hold.
Yeah, Sherwin, I was commenting about the warm weather now where you are, and in many ways having a negative effect on the behavior of especially young people in the United States, and really driving the infection rate through the roof in that country. Are young people largely responsible for the numbers we are seeing?
Not at the beginning, but certainly now, right? With the warmer weather, we were talking about this since March, the concern that as, people become frustrated with being cooped up in their homes and the weather getting warmer, people want to socialize, they want to be out and about. This is a vacation period, the summer months in the United States. The colleges are closed, universities are closed, schools are closed. The summer camps are closed. So essentially, there's a real desire to be out and about, particularly when temperatures are soaring above 30 degrees Celsius in a lot of parts. But let me give you some of the numbers. California, 6,800 new infections in the last 24 hours. Texas, 9,000. Florida, 6,300. Arizona, 3,300. Georgia, 1,500. North Carolina, 1,800. And largely driven by young people. Gavin Newsom, the California governor, that is also experiencing record numbers in new infections, tried to address this demographic a short time ago.
Sherwin, as the case numbers have soared in the United States, in some instances by more than 50,000 new infections a day. We understand that there's now a surge also in demand for testing and the inability in some areas to keep up with that demand.
You're absolutely right, Griselda. What we are seeing now across the country is a surge in demand for testing as the numbers are spiking. So you're seeing some 15 million tests have been conducted in June alone. But what we are now seeing, based on the surge of 50,000, 30 to 40,000 new infections a day, is that certain parts of the country are running out of testing capacity. We are seeing reports that in San Antonio, they are now, that's in Texas, one of the big cities in Texas, they are now encouraging people not to come for tests if they are not showing symptoms. And remember, this is in the context of the U.S. administration saying that, especially President Donald Trump, saying that anybody who needs a test could get a test. We are not seeing that anymore. We understand that some private laboratories have such backlogs that it's taking up to 7 days, up to a week for people to get their results. We understand that there are blocks, people queuing around blocks in cities in Phoenix, Arizona. So there is a great concern in this country that with the lack of testing and an increased lack of testing, surveillance is not going to meet the standards, certainly the CDC guidelines that are required in terms of surveilling and tracing and tracking where the disease is. So that's really the big concern, especially in the context of asymptomatic spread in the United States.
So, Sherwin, I mean, while the balancing act of reopening schools remains a big concern here in South Africa, this continues also to be a headache, I understand, in places like New York, where you are. How's the matter being approached by authorities in the United States?
Here's what we're seeing, right, Griselda, as much as you're having a concern in South Africa with how we actually implement the return of children to school and to universities, we are grappling with similar instances here in the United States. New York City, for example, has a school-going population of 1.1 million, some 1,800 schools around this city and this region. So it's one of the largest school systems in the country, and that, I think, makes it even more complicated. Some of the discussions they're having is, how do we sanitize these locations every day? Is it going to be a staggered approach where you have certain kids that will remain at home learning virtually while half the class then attends school in person for that week, and then they alternate? How are we going to use gyms and facilities and sports fields for classrooms so that you can have that social distancing? To what extent are kids going to adhere to CDC guidelines in terms of wearing a mask? What are they going to do during playtime? The unions are expressing concern in New York and other regions about the lack of personal protective gear for teachers, for bus drivers, for this cleaning staff at schools. These are complicated issues that we are grappling with, not only in South Africa, but around the world. And there is no silver bullet here, right? It's complicated here, and it's complicated where you are.
Sherwin, thank you very much indeed, as always, for your time. Sherwin Bryce-Pease, SABC correspondent in New York.